All right, Dr. Smith, we are now live on Facebook. How are you doing this evening? Thanks for joining us. And thank you all
Good.
the folks out there tuning in. I'm sure we'll have some folks filtering in as we move along. But thank you to those who are here now and who will continue to join us. Obviously, this is a very tough time. I appreciate you all joining us to get some information on, first of all, Dr. Smith and his medical background, and then moving on to small business and a discussion about that with Mr. Lionel Pierce. So uh, once again, I know I've mentioned this multiple times on our Facebook page, but just to get the message out, for those of you, if there's any struggles on for anyone, whether it's yourself, a family member, a friend, anyone in your circle, please, if there's any help you need, groceries, prescriptions, items delivered, anything like that, or anything you can think of, please contact us. You can do that in multiple ways on our Facebook page. You can go to truehealth.com and find our contact information really easily. We're looking for as many ways to help out as we can, and that's both on the individual level and the organizational level. So if you know of folks out there who are doing great work on in terms of providing for folks out there as a nonprofit or just an upstart group that wanted to help out with the response to COVID, we would really appreciate you pointing them in our direction, and we're more than happy to help out. So just to give a quick introduction, Dr. Lonnie Smith, he is an ear, nose, and throat physician. He owns his own private practice, been doing that for some number of years now. He also is a former board member of the Tulare Local Healthcare District, and he even has experience as a hospital administrator. So welcome, Dr. Smith. Thank you so much for joining us.
You're welcome. I'm happy to be here to help out as much as I can.
Oh, thank you. We can use it as much as we can get. So my first question really is pretty basic, Dr. Smith. Just looking at what folks can do to keep themselves safe, washing their hands, wearing a mask. So there's a lot of information out there, both good and maybe misleading. So help us kind of get to the bottom of the facts. What do we really need to do in order to keep ourselves safe?
Well, the first thing is, and I know this is not a very popular thing, but the first thing is you need social distance. This is the most important thing, along with, because if you're not exposed to the virus, you can't catch the virus. But we stay apart as much as possible while they are trying to get the vaccine and other treatments together. Thus, the will keep you safe, safest. The next thing is wash your hands, because most of the time the virus is being transmitted by droplets that we get on our hands, or virus particles that we pick up from doors, shopping carts, anything else we pick up. It can last up to 24 hours on cardboard. So you do things like that. So you got to keep your hands clean as much as possible. Wear gloves. Yeah, wearing gloves does help when you're out about in the public and you're going shopping stuff and pick up other things that people may have already touched. Wearing gloves does help. Mask. Masks are, especially the ones that we have available, the cloth ones and the surgical ones that are readily available, help you from transmitting it to other people more than it does protect you from people who would not have masks. So if more people that wear masks will keep the virus load down, because it will protect them, it'll keep them from spreading it to other people. So the mask works well if you wear them to keep you from giving it to someone else.
Mm-hmm.
The N95 masks, which are very hard to find,
right?
Actually, you probably shouldn't be at the moment going out looking for them, because those are the ones that they need in the hospitals and the caregivers need us for PPE. So you really shouldn't be trying to hoard those. Those are the ones that will keep the virus from coming into you. They will filter out 95% of most of viruses and other particles. Those masks are the ones that are the protective ones. But if everyone is wearing masks, what happens is it prevents you from giving it to someone else. Wash your hands. When you're out in public, wear a mask, and you try to social distance 6 feet at least is the best way of staying safe. And if you don't
Okay.
have to go out, don't go out.
Sure. Okay. Great to know. Like I said, there's a lot of misinformation out there, so it's good to get the folks the straight facts. Just moving into potential hazards and just looking at, okay, so say I'm a person who am beginning to exhibit potentially COVID symptoms, and I think I might be coming down with it. What should I do if that's the case?
Well, the first thing you do is you can talk to your physician, and I would call before I would go out and
Right.
talk to your physician and let them know what kind of symptoms you are having. If you really feel strong that you're having symptoms, other thing you do is isolate yourself. You got to self-quarantine. If you're not running a fever, but you got the cold symptoms and cough, runny nose, and maybe some body aches, but no fever, no chills, the first thing to do is you can self-quarantine so that you will, if you do have the virus, don't start spreading it. Because, right now we don't have a cure for it or treatment for it, so we got to isolate. If symptoms are, you start running a fever, difficulty breathing, and you have other things escalated, then you need to report to the hospital, to the ED, where you can probably end up getting tested and see if you do have or positive test for the COVID virus. But the first thing you do, if you just got cold symptoms, stay home, isolate yourself. And it's up to 14 days. It's a long time, but that's what we know, that the virus will be usually cleared by that time. The scary thing about the virus is that 90% of the people or more won't have any symptoms.
Right.
So that's the problem with why social distance is important. It's the people who we know have the symptoms, the fever, the cough, the chills. That's a small minority of the people. The majority of people walking around with the virus now and don't know it. They did the study down in Los Angeles where they did in USC and the county down in LA, and now UCLA is actually working on tests on the antibodies. They're assessing the antibodies in the patients down there, or even people who have no symptoms. And what they've extrapolated from that is that they've tested only about 3,000 to 4,000, but they feel from those extrapolations that there are 309,000 people in the LA area who probably have the antibodies. So that means they've been exposed and are asymptomatic. So that's the problem with this virus, and that's why we got to try to social distance as much as possible and wear the mask and do things because you feel great. That's wonderful, but you still may be contagious, and it's the people with the comorbidities, hypertension, diabetes, the elderly, people in the nursing homes, people who have asthma. Those are the ones who are going to suffer if the rest of us take it for granted that, oh, I'm fine, so I can go out and do what I want.
Right. Okay, that's great information, especially the first part that you mentioned, because I know a lot of the time, especially for those folks who don't have information readily available, if they show symptoms, they think they might be coming down with it because of how really uncertain things are right now, as much as overused as that word is these days. I would, just myself would think I should go to the hospital right away. But what you're saying is that's not the case. We shouldn't do that. Stay home. Make sure you contact your doctor. So that's great information. Just one thing I forgot to mention at the very beginning, and I see some folks are commenting on Facebook. Please, if you have questions, reach out on Facebook in the comments. We will be addressing those as they come in. So we did get one question here, Dr. Smith. Concepcion asks, on homemade masks, she has read that coffee filters are okay as a filter. Is that true, or is that something that may be misinformation?
I've never heard you use a coffee filter as a filter. I don't think that the pores in the coffee filter are small enough to do much of anything. because they have to let the coffee and the flavor through. So they had to be small, pretty large pores. You know, I mean, again, homemade masks are not going to be an N95.
Right.
If you put a coffee filter in there, it's probably still going to not filter out the smaller particles to prevent the virus. You're wearing the mask and you hope other people wear the mask so that you don't spread it to them. So if I'm not spreading to you and you have a mask and you're not spreading to me, I'm fine. I don't think that the coffee filter probably is going to be small, effective enough at filtering out the particles that are small enough that it will work in the mask. So I think that may be wise to tell.
Got it. Okay. Good to know. That's what we're trying to do here. Moving on, just to we talked about what you do if you think you have COVID symptoms. What should you do if you're sick and it's not COVID, but you have some other issue? Obviously, depending on the intensity of it, would be up in the air for how you would answer, I would imagine. But say it's just a run of the mill flu, for an example. What should you do? How should you go about contacting your doctor?
Well, again, you can call and you could let them know what your symptoms are. They'll let you know if they think that you should come in to see them. If you were to 6 months ago came down with the flu and you have stayed home because you knew it was the flu, it's probably safe to do the same thing now.
Sure.
Rather than panic and say, I have COVID and then go in. But I would still call my physician and get their opinion, see what they want to do. Also, even if a lot of the physicians now in the area, because of what HHS, Human Health Services, have done and CMS have done, are doing a lot more telemedicine,
Right.
telehealth, similar to what we're doing now. So they can then, if they want to see what you look like, they can actually do it this way. And so without, they think that, oh, you're bad enough, you shouldn't come into the office, they can at least look at you and they can talk to you, they can examine. You can actually, with the cell phones, do a pretty good exam. The light on the cell phone will illuminate things in your throat and your nose that the pretty good exam can go through. So you can still do those things and get the first opinion. Your physician will know whether you should come in or you should just stay home as the flu or just a regular cold. Or this time of year, a lot of people have allergy symptoms, a lot of runny nose, a lot of cough and sneezing from allergies rather than from any COVID symptoms.
Right. Okay. And that actually leads into my next question, which is just kind of more broadly. I want to focus more specifically, though, on what you just talked about in terms of telemedicine. Obviously, that's something that could be a change coming up in the future in the field of medicine. Obviously, it's been something that's been implemented to this point. But do you see this virus and this pandemic as something that may really highlight the importance of something like telemedicine? I mean, I have mixed
Yes.
feelings about it, but especially in the more rural parts of our district, it's very important for those folks who don't have access. But now moving forward, wanting to stay sanitary as much as possible, keep social distancing. Do you see this kind of filling that gap, maybe, or does nothing replace a visit to the doctor?
Well, telemedicine, it's been around for a while. CMS itself, or Medicare and Medicaid Center, they haven't pushed it as much as they did, except in rural areas, like you said. You mentioned that I was a hospital administrator. I was a hospital administrator up in San Andreas, California. A lot of people don't know where that is. You may not have heard of Angels Camp, but it's up in Calaveras County. And up there, physicians are a premium. There's very few physicians. There are few things. There's only one or two hospitals. And so we did a lot of telemedicine. And real telemedicine has been very important for a long time. But the platforms are now being pushed right now by CMS or the Medicare and Medicaid because they want people at home. And a lot of physicians offices have closed because a lot of physicians aren't set up to handle COVID patients. Some of us don't have the PPE or the personal protective equipment to handle it. So in order to make sure that there are physicians available to see patients or treat patients, Medicare has decided, well, we're going to start paying for it. Because before, they really didn't pay much for telemedicine. But now they're starting to pay for it, and they put $1 billion out there, and these platforms are starting to spring up now more because it's a better way to get to the physician because you can see them at home. Before, they would allow you to see the patients at home. You had to have the telemedicine wherever you build Medicare. Now, they've changed that. Medicare said, well, the doctor can be at home and see you. And so that, because a lot of doctors, again, they close their offices and they don't have the offices open. So now they can actually see you at home. It's the future. I mean, come on. How many of us have these? Most of us do.
Right.
And what's going to happen, the platforms are being rolled out. It's made it easier and easier to use it on your smartphone, easier to use it on your computer. So a lot of times there's going to be, instead of getting in your car and driving to the physician's office, you're going to be able to pick up your smartphone and do telemedicine. Now, there are some things you can't do. I mean, if you wanted to see me, I can do a very limited exam on my smartphone. I can see your throat real well, but if it's something in your sinuses, in your nose, and in the ear, then you're going to have to come see me. So there's still going to be the brick and mortar doctor's offices, so you have to come visit them. And if I need a biopsy, you have to do that.
Got it.
So you will have to come into the office in some, but there'll be a cold and flu you might be able to do by telemedicine, and that's the future. That's happening. Whether some of us who have been around for 30 years practicing like it or not, that's what's coming out there.
All right. Well, I mean, on the, like I said, on the sanitary side, it definitely makes a lot of sense, looking forward from this pandemic. Here's another question from Gary on Facebook. I don't know, you're not an insurance broker, but he's asking, what should you do if you don't have insurance? You have a good answer for that?
As far as the COVID?
Yeah.
Okay, well, again, let's go back to what the federal government done, especially through Medicare and Medicaid.
Right.
They have put money aside for patients who don't have insurance that the doctor can bill, not the patient, but bill Medicare and Medicaid and be reimbursed. So there's money so that everyone should be able to be seen, and everyone should be able to be tested once we get the test out there.
Right.
That should be able to be tested because they put aside money for that reason, for patients who don't have insurance, so that doctors can still see them and treat those patients.
Great. That's definitely helpful because there are plenty of folks out there who don't have that access still. And so being able to provide for them is really important. Before we get into looking forward and projecting more into the future beyond the telemedicine, another question about mask filters it looks like she's asking if converting sort of an AC filter, air conditioning, if that would have any better effect maybe. I don't know, it's hard to say looking into, like you mentioned with the coffee filter, just how large the particles are that can get through those. I'm not completely sure between well, it depends on what kind of AC filter you're talking about, I guess, versus a coffee filter, but I would imagine it's fairly common.
You had a HEPA filter.
What's that?
Yeah, I guess you had a HEPA filter. Some AC were used for allergies.
Right.
They put on the air conditioner for allergies. The HEPA filters, they will filter out pretty small particles. But if you want the filters that you can put in masks, you can probably buy those from places like Home Depot, Lowe's, because they have the replaceable filters for the N95 type mask, and Amazon carries them also. So you might be able to buy those kind of filters through those, and you can sew those into, or some people have made homemade masks with little pockets in them for the filters to slip in. So you can probably go on Amazon, Lowe's, or Home Depot and maybe find those filters rather than tearing up a HEPA filter from your AC, or again, coffee filters. I just don't think, I think they're too permeable. they're designed to let things flow through so you can make your coffee. I just don't think
right.
the coffee filter will work.
Yeah, okay, got it. just like I kind of have alluded to, how do you see this affecting the medical field, particularly folks with private practices, just moving forward? What do you kind of project for yourself beyond the telemedicine, just looking at what the future may hold? It's hard to say, but if you could make some projections.
Well, the biggest difference you're going to see, and if you go through a lot of doctor's offices now, if you see right now, I'm wearing scrubs. I don't normally wear scrubs, but I have them for my practice. But I'm wearing my scrubs because I don't want to take. If I do get contaminated by a virus that I don't know, no, I don't want to take it home. So I take these off when I go home and I change. You might see more of those things happen. You'll also see there's going to be more, especially until the vaccine comes out, which could be a year or more from now, and there's some kind of treatment. You're going to see more offices are going to have, they're going to be wearing masks and gloves, and they're going to take a lot more precautions. Your friendly neighborhood physician is not going to be sitting there in his tie and jacket or his Hawaiian shirt greeting you like he used to. It's going to be more as if you walked into an operating room almost. It's going to have a lot more personal protection. You're going to see a lot more spread out in the appointment times. Social distancing is going to be there in the offices also. It's going to be more telemedicine. We talked about telehealth is going to be more available and more prominent in the future. Other than that, the doctor's office should be the same. Again, there'll be more things about hand washing, and then they may have you to sanitize your hands as you come in the office too. And I, as an ear, nose, and throat doctor, I have to examine your nose and your throat. I have a lot more patients coming in. I have to say, oh, you have to remove the mask. Some of them don't want to do it, but I'm like, well, I can't look at your throat if you've got a mask on. So those type of things are going to have to be changed. It's not going to be medicine as usual. We're going to take more precautions to protect the patient and to protect ourselves. And you're going to see that as you go into office in the future. When the vaccine rolls out and is effective, things may slow down and go back more to what they used to be.
Got it. That's good news, I would say. Here we have another question from Facebook from Alex. He says, how much or maybe how much do you foresee doctors, nurses, health officials doing in response to people calling to open up businesses, all businesses, maybe necessarily right away? Do you see folks from the
Can you repeat the question?
speaking up about that and what kind of wanting to maybe at least be a part of that discussion?
Well, if you watch some of the news lately, you've seen healthcare workers in the middle of these protests protesting against the protest. And that's because what people seem to forget, they're putting their lives at risk. I mean, the PPE, you wear your mask, you wear your gown, you put your goggles on, hopefully your shield if you have it, and if you have the proper gloves, if you do that, but still the virus can get there. It can find a way to get there. They're afraid that the more you open up the business without doing the right kind of testing, the right kind of protection, and the right kind of social distancing, what's going to happen is someone's got to take care of those people. And it's going to come back on the nurses and the physicians. And that means that we have to put ourselves and our health at risk. And when you went to medical school, when I went to medical school, you knew that you have to work long hours and you have to take care of people. But a lot of these diseases weren't out like they are now. It wasn't that we came down and died from the disease because this disease was really deadly and something that could cause a problem. You weren't told that you might risk your life every day that you get up and go to work. If people don't take care of themselves, and there is a surge that they've been talking about. It hasn't hit Central California yet. It hasn't actually hit LA and San Francisco as bad yet either. But if it happens, then that's going to put a lot more of the doctors at risk and a lot more of the nurses at risk. You've seen nurses and doctors die in New York. They've died. And but they get up every morning and they go to work. Well, we want people to be responsible and take risks, not take these risks, and listen to us. So this is just science. We know how this stuff is transmitted, and how virulent it can be, and no one knows. It's like Russian roulette. You never know if you're the one that the bullet's going to go off if you catch it, or you're the one that you catch it and just nothing happens to you. And the physicians and the nurses and the other caregivers know this, and that's why they want you guys to just take it slow. So we can reopen, because I know everyone needs to work. I look at the lines of people who are looking for food and applying for unemployment and not getting it for months. Hey, that hurts everybody, and we all do. But what happens is, if when you get sick and we have to try to take care of you, and we know that there's no real cure at the moment for this, and you're isolated and you're sitting there and maybe dying, and we're the ones who have to take care of you. That's what the problem. That's why we ask them, take it slow. Let's reopen the country, let's reopen the business, but let's do it the right way so it's safe as possible. Because I guarantee you, when things start to open up a lot more, you're gonna see the numbers start going back up. It's because we don't know how many people out there now have this virus. They're keeping it at home, but when they start getting to more susceptible people who are going to pick it up from the people who have the virus, those numbers are going to start going back up.
Right. No, and that's why I have you here, Dr. Smith. I appreciate that insight, because for me, looking at someone who is looking to get elected and someday holding office, that's something that I'm a huge advocate for, is deferring to the experts, making sure that we listen to what our, in this case, doctors are telling us, and making sure that we really follow those directions, as opposed to some political flavor of the day necessarily. And so we do have time, it looks like, for maybe one last short question. I'm going to combine these two because we have one from Gary and one from Concepcion again. Just looking at talking about masks again. Do you or other doctors advise mandatory face masks for about 6 months or longer into the future? And then just looking at reusing masks, how long can you use it? I know for certain masks, depending if it's a cloth mask or something like that, that you discussed more for others' protection, you can reuse, you can wash. Maybe for more medical masks, that's not the case. And I don't know what the timeline would be on that. You can provide a little bit more insight on that. And then just looking into how long maybe we should be wearing masks into the future.
We should wear a mask until they have a way to treat the virus. So if we're talking about they're going to have a vaccine out within a year, then we probably should wear a mask for that length of time. So things are going to change. This is not going to be United States as usual until we get this vaccine, okay? So yeah, 6 months, year, until they get some way to treat it, and a vaccine, we should all wear masks. That helps prevent spread, because it's not going to go away when the summer comes. Right. And if it does die down in the summer, next flu season, it's going to come back. And then you're going to have to deal with the flu and COVID. So that's a double whammy. Mm-hmm. Okay. So we should wear masks until they have a vaccine that's effective against COVID. How long can the cloth mask, you can use them over and over and over again. Just wash them and use them again. The N95s, and those N95s are supposed to be effective for 2 hours. 2 hours. But they're in so short demand that we have to keep using them and recycle them. There is a way, there's a company now that's come up with a vaporized hydrogen peroxide treatment that will sterilize the mask, and so you can use it again and again by the same user. But it's not really available for me and you, but large hospitals have ways to get those things done. They send them out, and it takes about a couple of days to turn around to get them back. But they're supposed to be good for 2 hours, even though most people get one. In some of the hospitals, you get one, you have to use it the whole week. but they're actually supposed to be good for only 2 hours.
All right. That's great information, Dr. Smith. We have hit our time limit, so I really appreciate you joining us. If anybody has any questions for Dr. Smith after this, please leave us a comment or send me a message on Facebook, and I will pass it along to him, and hopefully we'll have an answer for you soon. Thanks so much, Dr. Smith.
You're welcome.